Impact of mechanical shock waves on calcification size in calcaneal spur and plantar faciitis. Plantar faciitis is reported to be the most common cause of heel pain. It's a disease that manifests a severe pain in the area inferior segment of the heel bone. In some patients, it occurs along the entire length of the medial longitudinal arch of the foot. It most often occurs between 40 and 60 years of age. The plantar fascia is connective tissue structure whose origin is on the anterior margin of tuber calcaneae. The plantar fascia has two important functions. Its first function is the effect of absorbing mechanical energy and involves preparing the foot to absorb the reactive forces of the surface. As a firm connective structure, it stabilizes the metatarsal joints, which is prerequisite for the foot to be able to absorb the reactive forces of the surface. The second function of plantar fascia is reflected in lifting the foot off the ground during walking. This function is called windlass effect. Risk factors for the occurrence of plantar fasciitis are the following: body mass index greater than 27 kilos per square meter, excessive running, intrinsic tightness of the foot and calf muscles, length discrepancy, occupation that require prolonged standing or walking, pes cavus, pes planus, etc. A calcaneal spur is described as a bony growth which forms in the region of the medial end of tuber calcaneae at the site where the plantar fascia attaches to the heel bone. In order to distinguish the calcaneal spur from cortical irregularity of the heel bone, the criterion was adopted according to which is a bone structure larger than 2 mm is considered a calcaneal spur. There are two theories that attempt to explain the origin of calcaneal spur: theory of traction and theory of vertical compression. Histologically, calcaneal spur consists of nucleus that is made up of mature lamellar bone, while intramembranous and endochondral ossification can be seen on the surface. The presence of osteoclast as well as the irregular surface of the calcaneal spur suggests continuous active regeneration of bone tissue. Treatment for plantar fasciitis and calcaneal spur is similar. It can be conservative or surgical and a mechanical shock wave. Calcaneal spur measuring technique. Classification of calcaneal spur. Duvrier described three types of calcaneal spur: type 1 large and asymptomatic, type 2 large and painful, and type 3 small and irregular. Ozdemir et al. Classified calcaneal spurs according to size: small 1 to 2 mm, medium 3 to 5 mm, and large over 6 mm. A mechanical shock wave is characterized by large amplitude of positive pressure, short pressure rise time, and small amplitude of negative pressure. There are a number of devices for generation of mechanical shock wave. Electrical hydraulic devices were introduced first, followed by piezoelectric and various electromagnetic devices. All of the above mentioned devices are intended for generating focused mechanical shock waves. Subsequently, radial shock wave devices were developed. They use compressed air or electromagnetic forces to launch the projectile located inside the device. The projectile achieves high speed, transferring its energy to the applicator, which is in the contact with the skin. Depending on the energy they have, that is depending on energy flux density, mechanical shock waves can be categorized as low energy mechanical shock waves of medium energy, and high energy mechanical shock waves. And the mechanism whereby mechanical shock wave act is complex and explained by mechanotransduction. Namely, mechanical energy causes change inside the cell, more precisely changes in cellular skeleton. In other words, mechanical energy causes changes in the cell that are reflected in the release of MNRI from the nucleus, which further affects various cellular structures as mitochondria, endoplasmatic reticulum, intracellular vesicles, etc. So the enzymatic reaction leads to improvement in the healing process. Indication for the application of mechanical shock waves are tendinosis calcarea, radial ulnar epicondylopathy, morbus dipitren, trochanteric pain syndrome, plantar fasciitis, achial tendinopathy, patella tip syndrome, tibial stress syndrome, hamstring tendinopathy, leather horse disease. Aims and objectives of this doctoral thesis were to investigate the impact of mechanical shock waves on calcification size in a case of calcaneal spur, to investigate the impact of mechanical shock waves on pain intensity in a case of calcaneal spur, and to investigate the association between the size of calcaneal spur and the pain intensity before and after shock wave therapy application. The research was conducted as a prospective study at the Clinic for Physical Medicine and Rehabilitation of the Clinical Center of Serbia, University of Belgrade, Faculty of Medicine over a period of 1 year. The study included 129 subjects of both sexes who were divided into two groups. The experimental group had 67 patients, while the control group had 62 patients. The Ethics Committee of the University of Belgrade Medical Faculty approved the execution of this study. The inclusion criteria were as follows: sensation of pain in the heel of the foot, an established diagnosis of plantar fasciitis, first episode, radiologically confirmed existence of calcaneal spur, patient above the age of 18 years. The patients who made up the experimental group were treated with the focused mechanical shock waves. In our study, 1,600 shock waves at a frequency of 10 Hz and with a shock strength of 1.6 bar were used. Mechanical shock wave therapy was performed every 7 days. The planned number of treatment was 10. Patients from the control group were treated with standard methods of physical therapy, cryotherapy, drug electrophoresis, magnetotherapy, laser therapy, and transcutaneous electric nerve stimulation stands for 10 days. Should be noted that cryotherapy was discontinued after 5 days. For those subjects whose pain did not decrease even after a series of 10 treatments, a 10-day break was made, after which another cycle of therapy of the same duration was administered. The size of calcaneal spur was measured in all patients in the beginning of the study. To this end, ultrasound or X-ray diagnosis were applied. Pain intensity was determined by using the visual analog scale for the pain. Pain intensity was determined using the visual analog scale for pain. VAS was determined in all patients in the beginning of the study. The same measurement was repeated after the end of the treatment. In the experimental group, patient had one additional measurement. VAS was measured after the 5th mechanical shock wave treatment. In our study, the application of mechanical shock wave therapy led to the reduction of the size of calcaneal spurs. This reduction was statistically significant as soon as the first 5 treatments had been completed. After the 10th treatment, the calcaneal spur was statistically significantly smaller as compared to the calcaneal spurs after 5 treatments. Mechanical shock wave therapy successfully reduced the size of calcaneal spur in our subject. The application of mechanical shock wave therapy reduced the sensation of pain in the subject participating in our study. VAS score values were statistically significantly lower in the subject after 10 treatment, as compared to the VAS score values at the beginning of treatment. The VAS score after 5 treatments compared to the VAS score at the beginning of the treatment was lower, however, it did not reach statistically significant values. Mechanical shock wave therapy reduced the intensity of the pain, but a greater number of treatments is required for the full effect to be achieved. The correlation between the size of calcaneal spur and the intensity of pain before and after application of mechanical shock wave therapy in our study was not statistically significant. Namely, the reduction in the size of calcaneal spur resulting from the application of mechanical shock waves did not correlate with the reduction in pain intensity. Mechanical shock wave therapy successfully led to a decrease in the size of the calcification as well to a decrease in pain intensity. However, for a better effect, the application of more treatment should be considered. Our results suggest that with an increase in the number of treatments, the size of the calcaneal spurs and the pain intensity would decrease to a greater extent. From all that has been stated above, we can conclude that mechanical shock wave therapy is an effective way of treating plantar fasciitis that is accompanied by calcaneal spur.